My name is Damali Ssali and I welcome you to this episode of the Ideation Corner. The Ideation Corner is a space where ideas are discussed and dissected. And today I host Dr. David Mwesigwa, who is the medical in charge of My Doctor. And he's going to tell us all about it. Dr. David, you're very welcome.
Thank you very much, Damali, for welcoming me and having me here at the Ideation Corner. I'm called Dr. David Mwesigwa, the medical in charge for My Doctor, Digital Healthcare Services. My Doctor is a healthcare service provider who deals in offering both what we call the traditional healthcare, and then also we are venturing into what we call, or what is termed as telemedicine.
Okay.
Someone might ask themselves, what is traditional healthcare?
What's the difference?
So traditional healthcare is the usual healthcare system that we've been used of, especially here in Uganda.
You walk into the hospital?
When I'm sick, I wake up, put on my dresses, walk into the hospital, I make up the queue, see the doctor, I get treatment, and I go back home. Yeah. So we venture into that.
You do that as well?
Yeah. And we have our facility. It is located in Nansana, Mastowa. But then we are also venturing into what we call telemedicine, where a patient can access the doctor from anywhere and at any time.
Okay.
Yes,
how does
please.
that work?
There are very many ways where people can access telemedicine, especially with My Doctor. Though right now we are mainly focusing at making it really very accessible to each and everyone at an affordable rate. Okay. So one of the ways where patients can access the doctor using telemedicine is through the direct phone calls. So
telemedicine is telephone medicine?
It is not,
but not only
basically telephone medicine, because there are a wide range of other appliances that can be used.
That is not the telephone?
Yes, please.
But did you just start with telephone? That's why they call it telemedicine?
Not really, but just because most of the ways the patients can access the doctors is through the telephone.
The telephone.
Yes, please.
So if I'm sick, how do I use the telemedicine side of My Doctor?
It depends on what you can access easily with you. Okay. If someone just has access to these small phones, maybe it's not a smartphone.
I have a capability, yes.
You have a capability, you can just call in at My Doctor. Even if you just beep. Oh. Our model of working, we are ready to call back and we see what were your concerns and how can we be able to address them. Okay. Then those who can access internet, we still use our numbers using the WhatsApp.
The same number?
The same numbers using WhatsApp, whereby someone can do video calling such that you access the doctor and can be able even to physically see you, though it's through the phone. Yes, please.
So I can talk to the doctor on video?
Yes, please.
And say, my leg is sick, there is the leg.
My leg is sick, it has a wound, so the doctor will be saying, let me have a look at the wound.
Have a look at the wound.
So you have real-time access to the doctor, but from wherever you are. Okay. You don't need to come in and walk into the hospital. Okay. Yes, please.
So let me say, which most people do have a feature phone, right? Yeah. And I call, or I beep. I like that I can beep. Because also, what if I don't have credit? Yeah. So I can beep. So what happens? My doctor one of your doctors will call me back?
Yeah. Depending on who receives the call, especially it's always received by the nurses at our reception. They try to get some basic information about you. They assess and they see which doctor could you really need. Would you need a general physician? Would you need a pediatrician? Would you need a gynecologist? Would you need... it depends on what you're suffering from. Then they will connect you to the doctor who is at the station or within that specialty, and you'll be able to talk to that doctor at that very same time. Okay,
so I have my capability. I beep. Then I'm like, hey, I'm pregnant. I'm feeling some issues with my stomach. They connect me to a gynecologist.
Yes, please.
Who is an expert gynecologist.
Yes, please.
Then they talk to me.
Yeah. So they talk to you, they assess you, and then we see, can you be helped from wherever you are? or you might need to come in the hospital, because you know health is versatile. There are some conditions whereby really someone can be helped without walking into the hospital. Yes. So that's what we are trying to remove.
But you don't have to always
that's what we are trying to eliminate. In case my health concern just needs an advice from the doctor, or just needs a prescription from the doctor, I don't need really to walk into the hospital, line up in the queue. I like it that even you talked about the pregnant mothers. We have our department called Godmother. What other people call as maternity, we really branded it as Godmother. Godmother is targeting the vulnerable pregnant women, whereby we're offering them antenatal healthcare services. Antenatal, this is where we give a mother health care from the time she has conceived up the time when she's just about to give birth. It also offers delivery services or labor services, whereby we monitor a mother, help her give birth, and we also care for the baby immediately. Then also that Godmother offers what we call postnatal. Postnatal, now this is this period after someone has given birth. Now the postnatal is both for the baby and for the mother. In traditional healthcare, a first-time mother is supposed to visit hospital 8 times.
After you've given birth?
Before. That is an antenatal. 8 times. That is a visit each and every month.
Actually, it's the 8. Well, you're pregnant for 9 months. So it's the 8 months of every month of pregnancy.
Every month you're supposed to be coming for checkups, for health education, for refills, and for a number of things. So with my doctor and telemedicine, we tried to reduce those visits to almost 50%, whereby a first-time mother is supposed to visit, is expected to visit at least 4 times. Then for us as my doctor, we always do checkup on those mothers twice every month, such that we eliminate that burden.
The need to
I have this concern, whereby most of the concerns the mothers are having are expected, and they are going to be there, just that she needs some moral support, some advice, and some counseling. So that's what we are eliminating. Then for mothers who are not first-time mothers, in traditional healthcare, it's always 6 times. So with my doctor, we reduce that to 3 times. That is still by 50%.
But you're still contacting them twice a month.
We contact them
so
twice
still getting
a month. You still get the service. You're in touch with the doctor in case of any health concern, health issue, advice that you need.
So, and you say that my Godmother.
Yes, please.
Godmother.
It's called
Godmother. It's targeting vulnerable women. In what way are you targeting them? Just by lowering the need for them to physically come, or what are the services?
So lowering the need for them to come eliminates a number of costs. One, what I didn't tell you maybe before, our teleconsultation for the moment is free of charge.
Is it?
Yes. So you eliminate the cost. You are supposed to pay, maybe if I'm coming in to see a gynecologist, you have to pay some consultation. Even if I'm coming in to be checked up by a midwife, you have to pay some consultation. So we are eliminating that cost. Secondly, we eliminate that cost of transport.
The transport cost.
I've moved from wherever I have to come to the hospital, to and fro. Remember, those pregnant mothers, always advise them to move comfortably.
So I can't jump on a border.
So sometimes either the spouse or the caretaker has to hire a vehicle to drive her safely. It's a bit expensive. So with the number of times that we've reduced that cost. Then also secondly, our prices for Godmother are a bit fair, whereby a mother is expected to pay around 200,000 for a safe delivery.
How much is on the market? How much is it?
On the market, on average, safe delivery costs between 400,000 to 600,000. So for us, we reduce the cost
to 200,000
by almost 50% to 200,000. Then also,
but the service, the quality of service is still the same.
Quality services still the same. We have a team of midwives, we have doctors on the station, and we also have gynecologists.
Okay.
Of recent, we've been helping mothers who even come in and pay zero cost. Randomly, we pick, we identify, we look and say, okay, this mother looks in such and such a state. Can we really come in and we see how can we help, but when she's receiving quality service, and we are seeing it's in a way helping the community.
Okay.
Yeah.
So you do, in a way, Godmother is a philanthropy, you're not making money off it. If you're subsidizing it this much. We
are subsidizing because our idea is how can we provide quality health care to everyone wherever they are at a very affordable rate.
Okay.
Yeah.
So, and for the because I'm very interested in this telemedicine side.
Yeah.
So of course, you know, in Uganda we know we don't have, often most people don't have health insurance.
Yeah.
So when you fall sick, you think you probably have malaria. You go to the pharmacy, you buy tablets and you swallow.
Yeah. So actually, that's one of also another issues that we are trying to curb. I would say 90% of the people who work into pharmacies move into pharmacies without a prescription.
Yeah.
And without even actually ever interacting with a doctor.
Yes.
So someone moves in, I have a cough, I have a cold, and what the pharmacist will always do, or the people in the pharmacy,
they'll sell what they have.
They sell what they don't sell what they have. They sell what they can use to get money.
Oh, so they
because they might have a number of options, but they will sell you one that is a little bit costly.
Okay.
So what we as my doctor we are doing, why even we are saying, let us offer free teleconsultation.
Yeah.
Let someone walk into a pharmacy, at least with a decent prescription. Yeah. Because it also saves us, we as the doctors. There is a very big trend that we are noticing, and it's affecting healthcare, making it even be more expensive. If you've heard about what they call drug resistance.
Yes.
Or antibiotic resistance. Yes. Why does it come about? It's coming up because of the self-medication. I'm suffering from this, I walk into the pharmacy.
Yes.
Almost all the time, we've tried to do some research. Most of the people who walk into the pharmacy will have to walk out with an antibiotic.
They walk out with an antibiotic.
But no test has been done to really ascertain that this person really needs an antibiotic. So someone keeps on taking antibiotics that are not needed in the body. They remain in the body unused, and they may end up making toxins. Someone becomes resistant. So by the time this person comes to the facility,
and by the time they come to the facility, they are very sick.
They are really very sick.
Yes.
They have used a number of over-the-counter antibiotics. So you have also now to pick what we call third line.
Because whatever you prescribe won't work.
It won't work for this patient. Yeah. So that's what we are trying to eliminate. Calling at my doctor at a zero cost. Engage with the clinician, doctor, whoever that will be suited for your condition, and they give you an online prescription. Walk into the pharmacy.
When you already know what you need.
Yeah.
Okay.
Then my doctor also offers the option of telepharmacy.
Okay.
Yeah.
That's good.
We can give you an online prescription. You purchase from wherever you want. But at the same time, you can still order with us. And our pharmacy team, yes, we deliver.
You deliver?
Yes, please. And our pharmacy team will deliver the medicine to your doorstep.
And if I don't feel good, I can just call you again?
Yes, please. You can just call in. You express what you're feeling. That, oh, maybe I'm experiencing this and this. Sometimes it could be because of the medicine. And other times it could be because of the sickness. And also other times it could be because of your lifestyle. So, an advice. Yeah.
Okay.
So we just say, at my doctor, your doctor is just a call away.
It's just one call away.
Yeah.
And I get, okay, so how do you, if I called, and whatever it is that ails me, because the first, you said, if I do make a call, the first line of contact, of course, are the nurses, who determine which doctor do you actually need.
Yes, please.
And then they connect me to a doctor from my doctor, right? And you have expert doctors who are there.
Who are always there.
All the time.
Yes, please.
If I call at 2 in the morning,
you will get a doctor to talk to.
I'm going to call at 2. I shouldn't tell you. At 2 in the morning, sometime this week.
You'll get
to
a
check
doctor
that I can get a
talk
doctor.
to. Yeah. So we've talked about just a few services that we offer.
What are the services?
But we offer an all-round, because someone like, okay, these people are concentrated in maybe maternity, just helping the mothers.
Yes.
We offer an all-round health care. We run an art clinic in partnership with the Ministry of Health and supported by MAUDME, IDI, GMS and other service providers. If you are to look at our statistics, the rate of HIV had increased, and the government...
In Uganda, generally?
Yeah.
From what to what?
I don't have the statistics off head, but the rate had increased.
I thought we were declining every year.
Of recent it had increased, and the government health facilities were not able to contain the entire population for a number of reasons. One, the staffing was too low. Yes. Then secondly, it was all about the geographic location. Yes. You find a division like Nansana having just one health center, of which it's a health center too. The division of Nansana, as of 2021, it has a population of around 530.
With one health?
With one health center, two.
Okay.
Not 3, not 4, not hospital. Health center 2. Health center
2 is what size?
If you are to look at the hierarchy of healthcare, health center 1 are the village health teams. Okay. If you have a kucharo, you get malaria prescription, you get Panadol. So health center 2 is the next level. The basic thing they do is immunization. They can do this testing of the strips, the first testing, but they don't do this other testing of machines and so on.
And Nansana has center 2?
Has a health center 2. It's called Nakule Health Center. Yes, Nansana has a division. Not the whole municipality, because the municipality is a big, but the division, it has a health center 2. So when you look at the population of 530,000, you compare to the service, healthcare service. So Ministry of Health decided at least to find some partners in private whereby they can extend these services.
Okay. So you're one of the partners?
So we are one of them. Okay. We are referred to as community distribution points. Okay. So currently our art clinic is serving 384 HIV clients who are on treatment and our monthly routine care and monitoring.
What exactly does that entail?
It entails giving them refills for their ARVs. It entails them coming to the facility or us visiting them. We get to know what other sicknesses are they having. For HIV clients, they always get what we call opportunistic infections. Yes. These come because someone's immunity is a bit lowered, so they are so susceptible to getting other sicknesses. So we have to be monitoring all that. Thirdly, we always do what we call counseling, continued counseling, because it's a sickness that really affects the mental health of, I would say, majority of people who are suffering from it. Yes. So we really need that counseling. So as my doctor in that line, we have also incorporated our telemedicine to help and serve those clients, whereby we offer phone counseling. We have a team of counselors.
So they can call at any time in case they're depressed, they can call.
We don't wait for them to call. For us, we schedule counseling sessions for them, and we say, okay, this day we have around 10 people that we are going to counsel. Okay. We are going to contact, and they have a session either with the doctor or with the counselor, and we see how best can we help them.
Yeah, so you reach out to them. You don't wait for them, because anyway, by the time they reach out to you, they are so
yes. Okay. Then also we help them and we deliver their antiretrovirals. There are those that you really assess. They are really doing well. They don't need to come at the facility for the regular checkups. So the monthly refill that they are supposed to get, we just dispatch and they receive it.
Oh, that's very convenient, actually.
Yeah.
And then I understand you also do, recently I saw you guys do a testing, an HIV testing drive?
It's not just a drive. HIV testing is completely free at my doctor. All the time.
Anytime?
The entire year, the entire watch,
So anyone can walk in at any one time at
anyone can walk in at my doctor.
And you get free testing?
Yes, they do. They get the free testing.
Okay.
But on top of that, every week we do 2 community outreaches in target areas.
Okay.
Of course, we don't go everywhere, but we try to look which people are mainly at risk of contacting HIV. So those are our targets. Where can we really get them and at what time? Sometimes it even makes us have to walk in at night. You go in the field around 9 because that is when you're going to get the target group
that you're looking at. Okay.
And I can assure you, we've never missed out on the targets. From January, from 1st of January 2023 to 30th of June, we've tested a total of 1,705 people.
HIV tests.
HIV testing, which is free. Out of that 1,705, we have 1,000, over 1,000 that are male, and then 653.
So men are testing more?
From our research,
or you're targeting more men?
It's not really our target, but from our research, we are seeing that men are testing more.
I wonder why.
Yet when it comes to the facility visits, women visit more.
Yes, because women, we normally look for... We're usually the ones who use healthcare services.
Actually, it has...
the testing?
It has caught our attention, and we are running a research about it. Why is it that more men are coming in for testing and few women?
But I think because there was a time when the HIV sensitization was targeting men quite a lot.
Could be, but then to our surprise, when you look at the results that we are getting, in that half year, we had 27 people who tested positive.
Out of the 1,705?
Out of the 1,000. Surprisingly, out of the 27, 19 are women.
So the women who are not the majority of the people tested are making up the majority of the people.
Because you see, from the number of people that we tested, the percentage of women is around 39, compared to 61 for men. Now, when you look at the positivity rate, women are occupying 70.1.
So do you think this is reflected then in the community, that there are more HIV positive women than men?
From our research, it is depicting so.
Because they're also not testing.
There are very many women out there who are not testing and are living with the HIV/AIDS.
So are you pivoting therefore your drives to also target now more women?
Of course, our pivot as my doctor, we are looking at it now, maybe changing. We are trying to make some articles and also trying to write some proposals.
This is new. I didn't know
to seek out, and we see if maybe we can get some more partnerships. We see how can we now help and we address that issue, because it's a concern. Remember, women are the mothers to the nation. They spend more time with the children, and HIV doesn't spread only through sexual interaction. It can spread from a number of ways. So if a very big number of women out there is not being tested and they don't know their status, we could have a high rate of the HIV still spreading unknowingly to all age categories.
Okay, but is that when you look at other statistics, is it the case that men are turning up more for other tests even? High blood pressure tests, these things, these drives that people do, is it more men who are turning up?
Not really. For other cases, we are seeing more women than men. Actually, when you look at our statistics for the facility at my doctor, especially for those that walk in, we have more women and children compared to men.
Except in this area of HIV. I wonder why.
When I shared with our supervisor for May, it took him by surprise, because ideally most people are thinking women test more.
Exactly.
But when he looked at also the statistics for our catchment area, there are statistics, because for them they have statistics for the number of facilities.
Yes.
They realized the same.
That actually more men are turning up for tests.
More men are turning up for testing.
For HIV testing.
Yes, for HIV testing than women.
That is so interesting. So you have to really start targeting women.
Yeah.
For HIV. And I wonder why this specific thing. Why is it on the HIV that they're...
We are also yet to get the answers.
That is so interesting.
Yeah.
So okay, so you're doing the telemedicine, you're doing the godmother, you're doing the HIV, you're doing quite a lot.
So that's what my doctor is doing. We try to offer an all-round healthcare services to clients at an affordable rate. Yeah.
Okay, that's very good. And then also we have issues, I think, as a community, that people don't visit the hospital until they're sick. They don't come for regular health checkups. I can tell you that I'm fortunate enough that I work at a job that covers my health insurance, but I never go for tests. So what are you doing in a way changing that?
Currently, we are running some social media platforms, some WhatsApp groups. We are on Facebook as My Doctor. We are on Instagram as My Doctor Africa. We are trying to do what we call sensitization. It is also part of telemedicine, by the way. It has very many branches.
Some you call it telemedicine, like telephone medicine.
So public health is also one of the part of telemedicine, and we are really doing so. We are always coming up with health tips, reminders, some which are even very well designed graphically. We have a team that helps us with that. We design those messages. We keep on sharing and engaging the community. Let us do this such that your health is this. Come for regular checkups. We try to sensitize them on the day-to-day routines that they are supposed to do, in the way of encouraging people to be well versed with their health on a daily. Okay, if I need to have this, I need to do this. Yeah.
But then how are you targeting those people who, because we have a lot of lifestyle diseases, of course, depending on the category of economic band that you fall into. But now we do have an economic band of people who sit in offices and they have lifestyle diseases, and they eat certain foods which then bring lifestyle diseases. Are you offering services around that?
Yeah. Part of our telemedicine, we look at monitoring those clients from wherever they are. We advise them to have the blood pressure machines with them. Right now we have the digital ones. The healthcare provider will just teach you on how to use it. And you can just say, oh, I measured myself and this is what I have. What can I do? Then we also have the digital blood sugar machines, the glucometers. Then on top of that, we came up with an idea that we are doing, whereby we do physical exercise and training at our facility.
Okay, so can people turn up for exercise?
Sure.
Okay.
So far, we've had 2 sessions, and the last session was really overwhelming. Actually, the space was almost getting filled, but we call upon more people to come and join us. Okay. We got into a partnership with one of the great sportsmen of this country, champion Gola Moses. So we always have him once in a month at My Doctor on Saturdays to come and take us through aerobic sessions and workouts. We, the medical staff, but at the same time to the clients. We target, it's for everyone, though also our target is on the pregnant mothers. They really need to come in and they do some exercise which helps us at the time of giving birth. We target the people who have the health lifestyle sicknesses like diabetes and hypertension, because in the core of treatment of those two, physical exercise comes as number one. Okay. We encourage those regular exercise. So it's really a fruitful exercise, and I think the next session we'll really be pleased if we can have you to come and attend.
I'll try. Yeah. Dr. David, so we are running out of time. Is there anything you would like to emphasize, something we've missed as we close out?
I really want to emphasize to our viewers out there that let us embrace telemedicine benefits that outweigh really the traditional healthcare. At My Doctor, you can really access the healthcare provider, a doctor, a specialist, basing on your health needs at any time, anywhere. We are just a phone call away. If you don't mind, I can share our phone contact. We have 2 numbers that are running currently for My Doctor. For Airtel, you can call on 0707 44 89 88. And then for MTN, you can call on 0762 31 84 31. But then you can also visit our website, whereby you can get to know more of what we are offering, and it is mydoctoram.com. I talked about our social media platforms, that is Facebook, which has My Doctor, then also Instagram, which have My Doctor Africa.
Okay. So
someone can follow us, can really get to know what we are doing, and easily, actually from all those platforms that I've talked about, you can easily connect from them to our facility.
Okay. Ladies and gentlemen, there you've had it. Please contact My Doctor before you walk into a pharmacy to self-medicate. Just make a phone call and then you'll be given free advice on what you should be.